As infections hit a record high yesterday, health leaders argued that the requirement for staff to isolate after a positive test risked being a bigger problem than the number of COVID patients. Paul Hunter, professor of medicine at the University of East Anglia, argued that COVID will become endemic and that eventually restrictions even on people who test positive will have to be relaxed. He said, "I think the whole issue of how long are we going to be able to allow people to self-isolate if they're positive is going to have to be discussed fairly soon, because I think this is a disease that's not going away." Professor Hunter also predicted that eventually people with COVID will be treated in the same way as those infected with the common cold. He said, "We're going to have to let people who are positive go about their normal lives as they would do with any other cold." Although the government has already cut the self-isolation period from 10 to 7 days, there are those who are calling for it to go further. Scientists, health professionals, hospitality chiefs and conservative MPs have urged the government to follow the example of the Biden administration in the U.S., which has cut the self-isolation period to 5 days. Around 800,000 people are thought to be currently in self-isolation, causing disruption to rail services, bin collections, businesses and public services. With infections increasing, the number of people going into isolation is growing. At time of writing, the number of daily cases peaked at 129,471 infections, including 117,093 in England and 12,378 in Wales. There are also fears that there could be a disrupted start to the school term next week if infections continue to rise. Sir John Bell, Regius Professor of Medicine at Oxford University, said that he would back 5-day isolation on condition that people were negative on lateral flow tests. He argued that this was a better way to measure if we're allowing people to go back into community than arbitrary isolation periods. On Monday, the U.S. Centers for Disease Control and Prevention, CDC, announced that the self-isolation period for asymptomatic Americans who test positive for COVID from 10 to 5 days. Chris Hopson, the chief executive of NHS providers, told the BBC that staff absence due to self-isolation is now the biggest pandemic-related challenge for the health service. He said, "We're now seeing a significant increase in the level of staff absences, and quite a few of our chief executives are saying that they think that that's probably going to be a bigger problem and a bigger challenge for them than necessarily the number of people coming in who need treatment because of COVID." Up to 40% of NHS staff in London could be absent due to the 7 self-isolation rule. Last week 3,784 NHS staff were absent because of COVID.